Steven Crowder, failed comedian, pretty much only has a show because he's willing to say whatever his corporate masters put in front of him, is rebutting the idea that COVID proves we need private health care. This should be good.
These people are willing to sacrifice their business's capabilities to step up for the greater good. And the fact that these stories are not front page everywhere at a time when the American public is panicked and you could offer them a sliver of hope is, to me, not only dishonest, it is journalistic malpractice. When it comes to the handling of
I'll deal with that when he actually says it.
The Chinese virus, have you heard the media celebrate any of the innovations made by the private sector? You're talking about retooling your factories for masks, for testing, for treatment, for therapeutics. I think that it's journalistic malpractice that these aren't being shouted from the rooftops right now.
Right. Yeah.
Shouldn't we want to give people hope?
Yes, I think that we should definitely shout from the rooftops about the clothes companies that are retooling to make masks so that they can benefit from the government relief. I mean, yes, I think we should congratulate companies like GM, GE, Ford, who are retooling their factories to make ventilators, except that they're doing that to make a profit. Now, what I want to shout from the rooftops, what I want to congratulate are the people like the local breweries around my home who have changed from making booze and spirits to making hand sanitizer. There's actually a brewery around here who has stopped making beer, and they're now churning out jugs of medical grade hand sanitizer for hospitals to use. That deserves congratulations. But GE, Ford taking high-end government contracts to make ventilators weeks after we're going to need them, that I don't think deserves the kind of praise that Crowder boy here is wanting to heap on them.
It seems that they want to give people false hope in this idea of Medicare for all, or a socialized healthcare system, because of course, this is what we need to talk about. The claim that we're seeing from the left on the coronavirus pandemic is that we wouldn't have these problems if we had universal healthcare. The public sector could make all of this go away.
So the reason why we're saying this is multifold. First of all, it would mean that our medical system is prepared to handle a larger degree of people. If you have a universal healthcare system, you have to prepare for dealing with any number of people. The other issue is the people avoiding testing even when it's available because they don't want a massive bill. And there's also the fact that the places with universal healthcare are able to mobilize enough people and enough resources because their people are generally healthier to help combat this. Also, this is the best frame I've ever seen for Steven Crowder. This is the most real he has ever looked.
Here's them saying it, because you don't have to take my word for it.
We will talk, I am sure, about Medicare for all. But when I talk about healthcare being a human right and all people having healthcare, the coronavirus crisis makes that abundantly clear as to why it should be.
Wrong.
Is the coronavirus the best case for Medicare for all?
Let's reverse that shot.
Coronavirus is a very good case for Medicare for all, but
it's like looking in through the lens of an...
This is why I don't feel bad about talking shit about Steven Crowder. He is absolutely detestable to every single person who even a little bit disagrees with him.
Aquarium.
Case for Medicare for all the time.
If we had Medicare for all,
Yeah, not much better.
we would have been far better prepared to handle the crisis.
There is no middle ground when it comes to dealing with a national security threat, and Medicare for all is an example of a policy that would take on that threat with the seriousness that it requires to be taken on.
What would Medicare for all do? It would ensure that people actually could get a test for coronavirus, that they could get treatment for the coronavirus.
Come again, retard? What was that? Here's the thing. I don't think we could have a more crystal clear case that the exact opposite is true. COVID-19, the Chinese virus, Wu flu, whatever you want to call it, there has never been more of a crystallization as to the need for private industry due to the sheer ineptitude of the government. They want to compare us to other countries.
Yeah, let's compare it to South Korea, who's able to keep their shit on lockdown, and their healthcare system was able to handle it, even though it's government run. The issue is not government, the issue is our government specifically.
this is something that actually I stumbled across. Let's take the countries at the top of the World Health Organization, their rankings, right? They rank us 36th, right next to Slovenia. Now, let's take them with a comparable population size to the United States. Let's look at their total deaths and deaths per capita. Italy's number 2 and Spain is number 7.
Italy had a bad outbreak and they didn't react to it fast enough. They reacted to it better than we did here in America, but they didn't react to it fast enough. And also, this data is way out of date.
Whoops.
We barely edged out Slovenia. Here's the truth.
So close.
Government mucked this up. Private industry is fixing it.
And
they're being held responsible with fixing it. So there are a few examples that we can walk through as to why you shouldn't entrust all of your health and healthcare needs to the government. Let's go back to the Obama administration, right? They never replenished the stockpile of masks after the Ebola scare. Now, I know before people are going to get upset, you're going to blame Donald Trump for not accepting masks from China. Here's the thing. The truth is a lot of these masks and test kits from China, they've had to be recalled by the countries that use them.
They're pre-infected, so they didn't know.
They came pre-infected.
Yeah, it was the pre-infected version. You don't want that version.
They thought it was like a cigar roller where they
no proof that they're pre-infected. And I'm honestly not sure about the Obama didn't restock. Okay, so the Obama administration used and did not replenish the nation's emergency stockpile of medical supplies, including masks. This is USA Today. The Daily Wire, the Obama administration significantly depleted the federal stockpile of N95 respirator masks to deal with the influenza outbreak in 2009. Okay. The U.S. never spent enough on emergency stockpile, former managers say. The article draws from the reporting of outlets including Bloomberg News and the LA Times after the influenza outbreak in 2009, which triggered a nationwide shortage of masks. Okay, that was a 2 to 3 year backlog. Orders for the N95 variety of the stockpile distributed about 3/4 of its industry and didn't. Okay, so looks like this is actually true, although this is definitely something that Trump could have corrected when he came into power and saw that it hadn't been restocked. But there's a lot of things Trump could have done to make the COVID-19 outbreak much better.
Test one cigar in every box.
Yep.
Like, box of 25.
You gotta do more.
It's not green. It's not a pregnancy test.
Yeah.
Oh, my bad.
It's kind of like those smallpox blankets. Same kind of thing.
I already pay shipping. So first,
but again, there is zero evidence that China has shipped us anything which contained COVID-19. This is just Crowder being racist, like he loves to be.
He talks about if we had socialized healthcare, everyone would be able to be tested, right? That's what that guy just said.
No.
So let's be clear that it couldn't be more dishonest. That is, if today we're opposite.
So if we had a nationalized healthcare system, there may be more tests available. So you can't say this definitively. But the truth of the matter is that there are not enough tests available. So not everyone could get tested, but more people would be able to be tested if we had a socialized medical care system, like every other developed nation in the fucking world.
Day, like if we were going into Scouts where they have opposite day and everyone wears their clothes on backwards because it's fun and we like to have a laugh, he would be tops. But here's another truth for you. At first, the CDC was the only place approved by the FDA to make the testing kits.
Oh.
Right? The CDC refused testing kits and capabilities from the private sector, and we all know how that turned out. Only once the private sector industry was allowed to step up, and this keep in mind too, they were already stepping up, but they
Nothing was stopping the private sector from stepping up except a lack of profit motive.
Weren't allowed to, did we see the improvement? Since then, what do we have? We have United States companies that have developed the fastest testing kits in the world. Abbott Laboratories, I have that name right. Yeah. Private U.S. company, they invented a COVID test. 5 minutes.
Boom.
You get results.
That's huge.
Only earlier this week. And then they were topped by another company, BodySphere, developed a 2-minute test that was approved today. 2 is the magic number. 2-minute COVID testing. Stick that in your pipe and kill yourself with it, CDC. And here's another problem. Not learning from mistakes.
Okay, let's see where those came from.
The testing kits.
Oh.
Right? The CDC was a testing kits fastest.
Okay. The FDA has approved emergency use of a new, there we go, Vox. FDA approves a coronavirus from Abbott. Let's see what Abbott Laboratories is. Abbott Laboratories is an American medical device and healthcare company with headquarters in Abbott Park in Lake Bluff, Illinois. They're publicly traded. My point I'm getting at here is that this may have been developed by a private lab, but that doesn't mean that it wasn't developed with public funds. Started used for rapidly diagnosing patients who are sick with things like influenza and strep throat. Test looks for fragments of the coronavirus genome in samples picked up through a throat or nose swab, used in a wide variety of settings. Okay. So this is an emergency approval, so that means that it hasn't gone through the full battery of tests, or a test like this. But credit where credit's due. It looks like a private industry did come up with a better test, but the issue is there's no reason to believe that they don't receive public funding, because that's how a lot of these labs function. And more to the point, there's no reason to assume that such a test would not be developed in a socialized manner. Remember that South Korea has a test you can get in a drive-through method, and it texts you your results minutes later.
Testing kits in the world. Abbott Laboratories, I have that name right? Yeah. Private U.S. company, they invented a COVID test. 5 minutes.
Boom.
You get results.
That's huge.
Only earlier this week. And then they were topped by another company, Bodysphere, developed a 2-minute test that was approved today. 2 is the magic number. 2-minute COVID testing. Stick that in your pipe and kill yourself with it, CDC. And here's another problem. Not learning from their mistakes. The FDA, they're still preventing private companies from creating as many tests as possible. They're only approving 100.
This is a testing issue. They haven't properly tested this new procedure, so they're not giving them approval to go ahead with the full procedure pending further testing. This is what a lot of private sector industries will do. They'll put out a test and they'll trumpet the test and they'll rush to production with something that hasn't been properly tested for all use cases. So in those instances where they haven't tested for a use case, something happens and then they come and ask for help and relief when people are dying because of their product.
100,000 a day when these companies could be upping it to 160,000 a day. The government is not here to help. I just want to make that very clear. By the way, hit the notification bell. If you're subscribed, hit all notifications.
This is a typical thing I hear right-wingers, but particularly of the breed of proto-fascism that Crowder is a proponent of. Government is ineffective, and so they do what they can to prove government is ineffective by gutting programs. Government can be very effective as long as it has the funds necessary to carry out its actions, carry out what it is designed and supposed to do, such as taking care of people.
Notifications so you're notified when every video goes up. It goes up at 9 p.m. Eastern. Of course, Mug Club Quarantine all month, $30 off, promo code Quarantine, and we are doing morning shows live, talking with you at 10 a.m. By the way, here's something else, just to show you how smug the media is. Remember, they mocked Donald Trump mercilessly when he made this suggestion I think it might have been earlier this week, at the most, last week.
They're throwing away the mask right away. They're throwing away, and when you hear 55 million masks, what I'm saying, 55 million, how could it?
Yes, because masks are single-use items. You're supposed to put on a new mask when you go to a new patient. I've heard from some people in nursing and medical field that they're given one mask and told, okay, that's your mask for today if they're lucky. Some people are reusing the same mask days at a time, which is only slightly better than not wearing a mask. Look at that guy. He's like, oh, God, this guy's going to say something real dumb.
Possibly be such a number. They say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks. I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more. They're sanitizing the masks.
Okay, a couple of things here. First off, this was assumed to be crazy, with leftist outlets claiming that he was irresponsible. Why? Citing federal guidelines, because the federal guidelines would, of course, be correct. Here's the thing.
Right. Federal guidelines in something like this are generally based off of best industry practices. There's a lot of materials that don't sanitize well. And we may not have a procedure capable of sanitizing for the coronavirus. That's the thing a lot of people don't seem to get with this, is that this is a completely novel virus. Yes, we've encountered coronaviruses in the past, but this is a completely novel version of it. We have no medicines or anything else that we know for a fact are 100% effective against them, like we do against Ebola and SARS and things like that. So it's entirely possible that it's more expensive to sanitize a mask than to produce a new one. Now, there are definitely cases where sanitizing a mask is the only way to get a good mask versus getting a new one manufactured if we have shortages and things like that. But There are likely reasons why we can't sanitize these masks. And again, I would trust something like the FDA over Steven fucking Crowder or Donald Trump.
Also need to separate what Donald Trump says from the soundbite that you see on Twitter. When you hear that
of course,
in its totality, like, oh, okay, that makes sense. He says, he even hedges his words. Some masks maybe, some masks not. But you have to understand the difference between what Donald Trump says sometimes and what he means. Well, we have some very fine liquids. And so the media says, he just thinks you can spray some Everclear on it and call it a day. No, what he was talking about was some kind of a system to make masks reusable.
No one is saying that Trump is so dumb that he thinks you just spray some Everclear on it and that clears it up. No, the issue is he has no idea what goes into these systems. He thinks he knows, and since he thinks he's the smartest person on earth, what he thinks should be true.
Recycling. You should be fans of that, right? No, not when Donald Trump says it, Jake Tapper? Well, careful, block your mouth. Don't let this tin can I'm about to hit you in the teeth, you piece of shit. Because Patel, a nonprofit, started using this mask sanitization technology. They now have machines that can sanitize 80,000 masks a day in Ohio, are shipping machines to other states. They'll hopefully result in 400,000 masks being cleaned per day. So I get it. Him saying we have some verified liquids, okay? Verified liquids, some absinthe, maybe a port, whatever it is that you want to assume he's saying, it's not that crazy. Every single journalist should be talking.
No one said it was crazy. What they said was that it's probably unfeasible with current technology and systems. If someone has developed a system that with 100% certainty sterilize these masks and make them like new, I am all for implementing it, even if it was Trump's idea. But that's not necessarily the case.
Talking about how now they can sanitize tens or hundreds of thousands of masks per day. We are going to have hundreds of thousands new masks made because of private industry who stepped up, who, by the way, didn't even have to be forced to by the Defense Production Act, and the FDA did.
No, they just had to be forced to by the profit motive. What the Defense Production Act is supposed to do is force companies that don't see a profit in manufacturing things to do so. Fortunately, I guess, Trump was able to let these companies find a profit in saving lives.
Approve the drug that Donald Trump was touting last week that you said was irresponsible because there was no kind of medical basis. You're wrong, and you should be happy that you're wrong because it's going to save, I mean, let's be honest, dozens of lives with this pandemic here going on. Here's another claim that they've made.
Again, downplaying the pandemic. We're over 1,000 deaths a day, people.
Quite a bit. That other countries with the socialized healthcare systems, that they've somehow done better than us. So let them...
But the federal government, the Trump administration, botching the rollout of testing for this virus, it continues to set the United States apart. FT, the Financial Times in London today, put out this graph showing how well various countries are doing in terms of...
Yeah, look at this. Almost 1,000 tests per million people in Italy, which has had one of the worst responses after the US. And over here, we barely have a line. No figure available for the total number of tests administered to date, 1,000 currently carried out daily. So France is probably testing more people than America. Definitely per capita. And also, again, this is cases per million people. Remember, there's 300 million people in America. There's something like 60 million in Italy. So even though this figure is like 10 per million people or something ludicrously low like that, that still means there's a lot more than Italy here, which has over 150 cases per million people. And there's definitely a lot more cases in America. We just don't have the tests for them.
Testing for the virus.
When you look at the best, the best healthcare system in the world, that's something that's up for debate. South Korea has up to 10,000 tests per day. They've been able to provide tests to any single person that wants it, and here people are scrambling.
Okay.
Yeah, I've heard at best we can do like 1,000 tests per day for a country of 330 million people.
All right, so let's get back to South Korea. Let's go back to Burt Ward's comments there. Burt Maddow, a country that they're talking about who they've praised for years, of course, based on the World Health Organization's ranking, which, by the way, I love now that no one can ever use that again. The Young Turks Network, the leftist organizations, you can't say, well, we rank behind France, Italy, Spain. Do we really want to talk about that anymore?
Yeah. Yes, because they were able to keep a control of it. We are just now, in the middle of April, starting to bend the curve in America. Italy virtually has it under control. South Korea has it completely under control. China, completely under control. Japan, completely under control. We are just now starting to get it under control. And I guarantee as soon as deaths start going down again, Trump is going to call for relaxing social distancing because we've beat it. We haven't beat it. We've just mitigated it to the point where it's not going to kill millions of people.
Yeah. We always knew that was the case because of subjective polling, but now you know it's the case because the entire world has seen it. Once Italy said, you know what, you're over 60, you're on your own. And that's not so old. They retire at like 35 in Italy. They don't create anything that benefits the rest of the world.
This is not true. This is just Crowder being shitty. I shouldn't need to say that, but I felt like I had to. People in Italy retire about the same age they do here in America. 60, 65, 70. If they can even retire.
Pasta was Chinese. Piss off.
Really?
So,
didn't know that.
Let's look at Italy with its nationalized healthcare system, right? They had by far the highest death rates. And its population, quite elderly, of course, the intensive care units, they were just advised, they said, what do we do with these elderly people? And I said, well, just don't do anything. But what do we do? How do we help them? We just don't help them because we can't raise taxes anymore and people don't work.
Yeah. But you said
As far as I know, Italy has a functioning fucking economy. They're not Greece. Even if the primary of their economy is tourism, they still had a functioning economy. God, Crowder pisses me off.
We call the government.
Yeah. And the wait times, of course, we've talked about this before. The wait times are terrible. We've talked about this with all these countries. You can go back and watch our socialized healthcare videos, and people don't work.
Yeah. But you said we call the government.
Yeah. And the wait times, of course, we've talked about this before.
Average waiting time for specialist medical care. Neurologist. Yeah, these are specialists in non-emergency situations. Hip replacement, carpal tunnel. Yeah. And also, apparently there's been a lot of corruption in the Italian medical care system, so this isn't great. But also consider that a lot of this is because they have an aging population, and these things are going to be necessary at some point in everyone's life. But they're not necessarily mandatory necessary right this instant. Moreover, this is ignoring the infinite wait times from people without medical care or insurance who will never get to see these people and will die because of things that could be corrected if we had a decent medical care system in America.
Wait times are terrible. We've talked about this with all these countries. You can go back and watch our socialized healthcare videos. And if you have a broken arm or something, to them it's a nuisance because it's non-essential.
It's like a nosebleed.
But now when it comes to a pandemic, there can be no debate. There's no denying that the wait times increase the mortality rates. And at the very least, it's a violation.
Which means that the higher wait times in American emergency rooms, which is true, America has higher wait times in emergency rooms because people use emergency rooms as their primary care practitioner. More people are going to die in America due to the wait. And that's ignoring the fact that America is by no means ready to handle this issue.
Violation of human rights to not allow people to purchase privatized healthcare, which is increasingly rare in these countries, but that was the case in Canada, at least until 2005. Let's go to South Korea, by the way. This is one that really bothers me as people point to South Korea.
Does it bother you, Stephen? Why? Because the Koreans managed to get it right? Does that bother your little racist heart?
Sure. They were ahead of us on testing, absolutely, because they quickly mobilized. And what do? They used the private sector for testing kits, which the CDC here said, no, you can't do. Now that we're doing it, we're surpassing South Korea very quickly.
Oh, yeah.
Also, something that when people point to South Korea as
we're not surpassing South Korea. Did you see that chart he put up? We are not surpassing South Korea, sir.
Successful example of the social distancing protocols, they effectively doxed their own citizens.
Yeah.
They were tracking the phones of citizens and then released detailed information to the public via apps, including age, descriptions, and movements over the past few days, so that people could say, okay, I see. Man have a sneeze, go to park. We kill him.
Yes.
So if we want to point, this is something really important, because when in trying to demonize the United States because of the communist sympathizing media, and I mean that because they were actually parroting communist Chinese government talking points, I say that without a hint of hyperbole, hyperbole is hyperbole, and I throw a pipe at the camera. There you go. It's like a 3D show on TGIF. Without a hint of hyperbole, this media, who is sympathetic to the Chinese government, they will take any opportunity to demonize the American government at all costs. Well,
I don't know that South Korea is particularly sympathetic to the Chinese government. They may be as a matter of course because China is the biggest power in that region, but let's see what he claims they're parroting.
When you tell them we should be like South Korea, let the American public know what they did. Americans, you think they have a greater success rate here in dealing with Corona? Okay, if you just want to use one metric, but are you willing to turn over all of your phone's data? Yeah. Are you willing to turn over all of your location services? Not to your private web searching on your iPhone?
First of all, that information is already available to Google and Apple. Just to be clear, none of that information is truly private. If you think it is, you don't understand how our mobile phone systems work. That being said, I don't think it's a terrible idea to keep track of people's movements during a pandemic. That's a very slippery slope and can lead to some very bad things. But what they did in South Korea was institute a quarantine and the shelter-in-place orders, which we've done in America. And that is done to save the majority of lives. I know a lot of things are coming in order to increase power of reactionaries and authoritarians as a result of this coronavirus. But there's a lot of things government can do to help save lives.
You want to turn that over to the government so they can release it to the public? Because that's what South Korea did.
I know, you could...
Wasn't the South Korean leak accidental? Expose private lives. Safety guidance texts sent by the authorities contain an avalanche of personal information and are fueling social stigma. As the number of coronavirus cases in South Korea exceeded 6,000 this week, there was a rise too in complaints about information overload in the form of an emergency virus text alerts that have included embarrassing revelations about infected people's private lives. Health authorities and district offices across the country are sending safety guidance texts from early morning to late at night, reminding people to wash their hands thoroughly and not to touch their faces with unwashed hands. Intended as a public health service are fueling social stigma and in some cases leading to speculation over extramarital affairs. Wait, a woman in her 60s has just tested positive, reads a typical text. Click on the link for the places she visited before she was hospitalized. The website of district office that lists the places. Okay. So it sounds like what's happening here is the Korean government is releasing information of where infected people have gone, so uninfected people know to avoid those places. But they're not releasing information. However, the information they're releasing is allowing people to put things together. It's like when a few years ago, a bunch of Google searches got released by hackers. And people were able to figure out who people were, who the searches belonged to, based not just on vanity Googling, like where you Google your name, but different things like websites they visit and searches they made, and cross-reference that with public information about people. So it sounds like that's what happened here, which is still not cool, but I honestly agree with this. Hey, a woman in her 60s has tested positive, and she visited the post office and the fish market and this other place.
Kill everybody who has this virus as well and have 0 new cases.
That's absolutely right.
You could do that and just report, hey, we're doing fantastic.
Works.
We killed It's kind of like Russia, right? We don't hear anything out of Russia. I guarantee you they have some. And they're like, we'll just kill them.
That's what Pelosi did with her cabinet. Yeah. You don't see them anymore. No. Have you seen her assistant bringing her a coffee?
No.
No.
Not in a while.
She needs their souls to sustain herself. So, another truth. We weren't as far along.
Only we're allowed to shit talk Pelosi, Crowder. Fuck off.
As other countries. That's true. Once we started testing, and we started testing more people in 8 days, I think, eventually, than South Korea tested in 8 weeks once we started testing. And now, of course, we have more privatized industry, as we talked about, stepping up so we can test more people. Again, bottleneck.
That sounds incorrect. We tested more in 8 days than they did in 8 weeks. Yeah, 12 hours ago? As the coronavirus spreads rapidly around the world, killing thousands and leaving governments scrambling to deal with the fallout, one country has repeatedly drawn praise for its efficiency in dealing with it: South Korea. After the first test cases appeared, the South Korean government ramped up testing at a speed almost unimaginable in the United States. Its swift response slowed the spread of the virus and saved thousands of lives. As of April 8th, South Korea suffered 200 deaths due to the virus, 4 per 1 million of population. And the number of new cases has slowed, while the United States has suffered 13,000 deaths, 39 per 1 million population, with new cases continuing to grow quickly. Yeah, close cooperation between the state and the private sector, because they had a fascist government until fairly recently, and the South Korean public's willing and almost enthusiastic embrace of large-scale medical intervention, in the South Korean experience of rapid industrialization and nation-building during the Cold War. Yeah, squabbled with 3M and General Motors over the production of masks and ventilators. Government and private sector worked together seamlessly in South Korea. Companies responded quickly. Yeah. So this is a situation where the government dictated to the private sector what they needed to do to fix this, not that the private sector stepped up and did what they thought was necessary. This is much closer to using the Defense Production Act than private sector saving people. So it's entirely possible that we have tested more total people in America than South Korea has. That I would believe with no issue. And look, here's directly refuting the statement Crowder made. President Trump made the claim, but the U.S. isn't there yet. Here are the numbers. And this is from 16 days ago, so this is 2 weeks ago. On March 24th, President Donald Trump stated that we've done more tests in 8 days than South Korea has done in 8 weeks. Okay, so this is just Crowder regurgitating Trump's lies. Gotcha.
CDC, socialized government. That's what we're talking about here, right? Socialized healthcare run by the government versus private industry coming out with a 5-minute test and a 2-minute test. I bet you the next one
And I'll bet if the government had been more involved in dictating what these private companies would do, we would have that 2-minute test distributed out to as many places as possible by now, because they wouldn't be worrying about a profit motive. And if they're not worrying about a profit motive, then they're almost certainly government funded, in which case it's basically the government doing it.
You just start to say the word test into the test like you're positive.
Yeah.
Just it could tell by my viral
every time.
load.
That's a terrible test.
More than any other country in the world right now, as far as that. So that talking point is gone as well. Yeah. Here's another.
It's not, though. Again, we may have, just by sheer volume of people in America, tested more people. But as a function of our population, we are still way down there.
Another point that they'll still use they'll make. Another area where the United States actually, by the way, is doing really well because of the private sector. Independent researchers, they found success with combination therapy. We don't have a cure, but we do have what they call therapeutics. We do have treatment. Donald Trump went up and talked about chloroquine, I don't care.
Fish tank
chloroquine
cleaner.
and antibiotics. Fish tank cleaner. Just go home.
That's how it's pronounced.
Just take a shot and tell us how it works out.
Don't.
He was mocked. Bill said he was mocked across the media. Right. This was your response.
He pushed it because he has stock in a company that makes this chemical. So even if he's right and it is a potential therapy for COVID-19, that doesn't mean Trump is some visionary oracle who knew this was the drug we needed. He just saw someone and said, well, it might do something against COVID, and was like, that's the cure. That's what we need, because he knew its stock would go up.
Well, now it's FDA approved in emergency uses. It was already an FDA approved drug because of its safety profile, but now it's FDA approved specifically for coronavirus. But before that, a private practitioner had prescribed it off-label.
I hadn't heard that it'd be FDA approved. Okay. Therapeutic options for COVID-19. Okay. Our oral prescription drugs have been used for treatment of malaria and certain inflammatory conditions, are under investigation in clinical trials for pre-exposure or post-exposure prophylaxis of SARS-CoV-2, the COVID-19 infection, and treatment of patients with mild, moderate, and severe COVID-19. So as of, this was updated, 2 days ago? 3 days ago? It is not passed. It is still in trials. So once again, looks like they did receive emergency authorization. Recent food emergency use authorization for 2 malaria drugs to treat COVID-19 based on thin evidence of efficacy has jeopardized research. Yeah, so it's not that they've given it their full support. It's that they've said it can have some effect, so let's try it on live people. So another live from Crowder. Awesome. Love those.
Label had 699 people who were treated successfully, not to mention all of the independent testing, which we talked about on this channel, and this is really concerning. Twitter and YouTube were removing or censoring videos that talked about chloroquine as fake news or
Maybe that's why he's not even trying to pronounce it right, so it doesn't get censored by YouTube.
Talked about Chinese masks being faulty. They removed some of these tweets and videos. How scary is that when these people...
Because if you don't actually present actual evidence, you're just spreading potentially false information.
are in charge of fact checking. And not only are they dishonest, but they are dishonest in a way that could save thousands of lives. When we're talking about a vaccine, yes, researchers are working on a vaccine, and it'll probably take about a year and a half. Why? Mostly because of the FDA baggage. Just for the
Oh, poor FDA wanting to test a vaccine and make sure that it's not going to kill people. All vaccines have to sit in a human for up to 14 months to make sure that they don't kill the person. Because if you have a vaccine that you want to roll out to the majority of the human population, you have to make sure that it doesn't cause them to drop dead 6 months in. This is the real reason why this is going to be a problem, because the only way we're going to correct it, unless hydroxychloroquine or some other drug is an actual miracle cure, we are going to have to stay sheltered and socially distanced until we have a vaccine. And that is a minimum of 15 to 18 months from now. Minimum. That's assuming that the vaccines that have already been injected into people for those final human trials actually work and don't have worse complications than the COVID.
The same reason as chloroquine, right? It's really hard to move a barge. It's sometimes more helpful when you have Donald Trump coming in with chloroquine and another barge going, "Get over there!
Get out of my way."
It does help. It's terrible.
This show's more of a tugboat. It's easier to move. So here's something, while we're talking about, we do have to get going with Razor Fist, and then we'll see you tomorrow for Good Morning Mug Club. But this is something that just bothers me.
He had Razor Fist?
I don't think it could possibly be more.
He had Razor Fist on? Holy shit. Razor Fist is worse than Sticks and Hammer.
Clear at this point that we need the private sector.
The
only other country that's had success beyond doxing its citizens when you look at South Korea is because they did mobilize the private sector. Once we started doing that here in the United States, guess what? We start doing better. And guess what else? Donald Trump starts speaking directly to his audience with these evening press briefings.
No, it's not the mobilization of the private sector that is letting us do better in America. It's that we finally have people taking social distancing seriously, and all we're managing to do is slightly bend the curve.
Yeah. His approval rating goes up. So what do? Let's stop airing Trump. Let's run a story about people who drank fish tank cleaner to condemn Trump for touting a drug. Oh, wait, it's been approved by the FDA and it actually...
Emergency approval. And on very thin evidence.
Shows some level of efficacy. Let's not cover it. Let's blame Donald Trump for saying that we should be able to sanitize masks. Oh, wait a second. We actually can do that now because private industry stepped up to do it. It's almost like Donald Trump said this.
Apologies if people just assume that the shit that comes out of Trump's mouth is complete bullshit and has no bearing on reality. That's just kind of how Trump rolls, so forgive us for assuming that. It's only been the truth for the last 5 years.
Kind of knowing what was coming around the corner, let's just silence this. This is an amazing situation for me because after 9/11, and I know that a lot of people didn't like George Bush, at the very least we came together for the common good, and right now we're fighting this sort of invisible enemy. I know some people saying it's not technically invisible if you have a microscope. I don't care. The point here is that...
No one would object to calling coronavirus an invisible enemy. This is him just being anti-intellectual.
I don't know if there'll ever be a time now where we'll come together again against an enemy. If something could ever help us find common ground, it would be this right here. And I don't just mean fighting a virus, but I mean the idea that we are making unbelievable headway, and we are making headway not from tearing people away from their jobs and place of business and having them holed up in their apartments, though some people need to continue doing that, obviously, but we are making headway because of American businesses innovating and stepping forward to save fellow Americans' lives. I know it's a bad narrative because we want to think that capitalism is greedy and bad, but guess what? These people are...
Capitalism is greedy and bad. The only reason it worked in South Korea was because the government was able to essentially dictate to the corporations what they were going to do and build. We're not doing that in America. We're letting the markets decide. And that's why we don't have enough ventilators, why we don't have enough masks, why we don't have enough tests.
Are willing to sacrifice their business's capabilities to step up for the greater good. And the fact that these stories...
They're not sacrificing shit. They're taking plants that would have been left empty and retrofitting them to make ventilators so they can make money off of this situation. They're not sacrificing anything.
Are not front page everywhere at a time when the American public is panicked, and you could offer them a sliver of hope is, to me, not only dishonest, it is journalistic malpractice. I don't even know if that's a real thing because you're not really held to any kind of a standard like a lawyer or a doctor, but
journalists are definitely held to a standard. He's not right. He's wrong that this is journalistic malpractice, but journalists are definitely held to a standard.
if you could be, we'd hang you up at dawn before breakfast. Figuratively speaking, of course. Not literally. I just want you fired and on the unemployment line with everyone else who you've harmed. Hey, if you enjoyed this video, click this box because you'll enjoy Gerald's show that he hosts.
Yeah, fuck off, Crowder. That was about what I expected. Crowder regurgitating Trump's lies and just being overall a shitty person. Let's check out the comments for a minute. Just your daily reminder that Epstein didn't kill himself. Good to see we still have some comrades in the comments. Every time I see a headline with a Trump quote, I immediately go and look at what he actually said. 99% of the time the quote is incomplete, out of context, or flat out wrong. Hopefully the independent voters are realizing this. Hopefully they're not. I'm actually surprised that China didn't just kill all of their infected. Obamacare, we will schedule your Kung Flu test for 6 weeks from now. Yeah. So yeah, Steven Crowder is a piece of shit who lies for profit. So easy being a right-wing grifter. I wish I didn't have the morals I do. Hey, thanks for watching. Hope you enjoyed the show. If you liked it, like, share, subscribe, and leave a comment. Thank you. See you next time.